Hi everyone, I'm Dana Moore, Clinical Lead at the Cedars at Beulah Gardens Assisted Living. Now I would like to talk to you about point of care risk assessment. Point of care risk assessment is something we've always practiced in healthcare. It's when you assess your situation before you start to work, and especially before working with your clients or residents. It's usually used to screen to see if your resident is having any indication they might be physically or verbally aggressive. And sometimes you might see the purple triangle, the purple circle to indicate there might be a risk of violence. That's where we usually saw the point of care risk assessment, or scanning your environment to look for safety concerns, such as water on the floor. This is how we used point of care risk assessment before COVID-19. Now that we're in the pandemic, we're using point of care risk assessment to keep ourselves and others safe before we do our direct care with the resident, or before we do housekeeping tasks or deliver a meal tray. Essentially, whenever you start to enter a resident's room, you need to be using your point of care risk assessment process. It's a series of questions you will ask yourself before you get too close to the client, and to keep you safe from a potential hazard. And in this case, our hazard is the COVID-19 virus. The 5 questions to be answered during the point of care risk assessment are: do I see a hazard in this situation? So you want to be observing. Observe, is your client looking well, or do they look sick? Do they look like they might have a fever? Do they look weak? Really check your resident and use your observation skills, and then listen. Do you hear anything? Are they having difficulty breathing? Are they sniffling? Are they sneezing? Are they coughing? Then you can ask your resident, how do you feel today? You can ask, have you been coughing? Have you been sneezing? Do you have loss of taste or diarrhea? There's a series of questions we ask for COVID-19. And here at the Cedars, we've also created a tool that you can take with you to the residence room. It's laminated so you can wash it, and it'll be very sturdy when you're using it. But this is for cases where the resident is having trouble communicating verbally, or maybe you don't speak the same language. This pictogram tool will help you ask about those key symptoms of COVID-19. And again, this is part of your risk assessment when you enter the room. The second question to ask during your point of care risk assessment: what is the health status of the client? Are they somebody who's at risk for COVID-19 because of underlying health conditions such as diabetes or congestive heart failure? We want to be really careful with our residents who are more ill, and really be watching for those symptoms very closely and report to the nurse on duty. Third question: what type of task am I doing right now? If you're going to be doing direct care, you'll have all of your PPE on, your eye protection, perhaps a shield, or perhaps a gown if it's necessary. So make sure you are protecting yourself by wearing the proper PPE, especially if the resident is on contact or droplet precautions. The fourth question you ask during a point of care risk assessment is: where am I doing my task? If you're going to do the task in the resident's bedroom, you want to do your point of care risk assessment before you enter the bedroom, or if they're in the bathroom, the same thing. Before you enter and get near the client, you really want to have used all of your observation skills and communication skills. At the Cedars, we would like you to step away and phone the nurse right away, or press the resident's pendant if you're a student, so that staff can come to the scene and report those symptoms before you are too close to the client. We are going to take a proactive approach and look for tiny symptoms right away so that the residents can be assessed properly by the nurse to see if we need to do perhaps a COVID-19 swab or connect with the doctor. Number 5, what action do I need to take during my point of care risk assessment? I just explained it earlier, but again, just to reiterate, if you hear something, see something, or the client tells you something that indicates they might have COVID-19 symptoms, please stop what you're doing, take a step back, report to your nurse or the manager or your supervisor or another staff member if you need help so that we can follow up and keep everybody safe here at the Cedars. We don't want you to feel unsafe or put yourself at risk. It's better if we can work together and keep our working environments really safe. So just one more note, we're wearing our PPE with every resident. Over-reliance on PPE can create a false our PPE can create a false sense of security. So it's just not PPE alone that will protect you from COVID-19. While it does provide protection, we need to use all of our measures, infection control, hand washing, observing and checking for symptoms, physical distancing, and our PPE. All these things together will help us with the fight against COVID-19 here at the Cedars. Remember, before every interaction with your residents, you must do the point of care risk assessment to make sure it is safe and report to the nurse or your supervisor if there are concerns. And thank you very much for all your hard work during this pandemic. We really appreciate it. You're keeping everybody safe.